focus of this session will be on using a framework for treatment planning that we call the 4 Ps of pain management. In this session, there's only one learning objective. We will describe a framework for pain management that includes pharmaceutical, psychological, physical, and preventative strategies for pain management. Each of these different categories of pain management will be explored more fully in subsequent sessions. Recall from a previous session what you learned about how nociceptive pain works. Under normal circumstances, sensory stimuli caused by damage or the threat of damage to body tissues results in activation of nociceptive receptors and nerves. This information is transmitted to the spinal cord, brainstem, and brain, where it can be influenced by many different factors that alter or modulate the nerve activity. When we treat pain, we may change nociception and/or how that information is processed by the spinal cord and brain. This is true regardless of whether we use a pharmaceutical, physical, or psychological treatment. We use the nervous system's ability to modulate its own activity and alter the experience of pain. Regardless of the type of pain someone has, most people benefit from a multimodal approach to treatment that includes pharmacological, physical, psychological, and prevention strategies. We call this the 4 Ps of pain treatment. Treatment teams should consider identifying strategies in each of these 4 categories when developing a pain care plan for clients. In the next 3 sessions, we will cover medications that can be used for pain management. Different types of pain respond better to selective medications. For example, nociceptive pain may respond better to NSAIDs or opioids, whereas neuropathic pain or pain amplification syndromes may respond better to adjuvant medications, such as antidepressants. It is important to determine what type or types of pain are present in order to provide the most effective treatment. This is a list of the most common classes of medications that are used to treat pain. However, it is not an exhaustive list. Physical strategies include both passive and active strategies. Active physical strategies are very important, both to reduce pain, but also to prevent disability that can be associated with pain. Examples of active physical strategies are general physical activity, such as walking or dancing, as well as specific exercises that address impairments such as a limited range of motion or muscle weakness. Passive physical strategies include treatments such as manual therapies, like massage or joint mobilizations, acupuncture, electrical modalities, such as transcutaneous electrical nerve stimulation, or TENS, and thermal modalities, such as warm and cold packs. There are many psychological interventions that can be effective for either chronic pain or brief acute pain. Some strategies are very simple, such as distraction or relaxation, and others require more intensive interventions from a trained mental health care provider and active participation by the client, for example, cognitive behavioral therapy or hypnosis. Psychological interventions may aim to reduce stress and fear or improve coping with pain. Examples of psychological interventions also include education about pain, meditation, prayer, imagery, and distraction, such as listening to music. Some therapies combine physical and psychological aspects and are known as mind-body therapies. Examples of this are yoga and Tai Chi. A final category of the 4 P framework for pain management is prevention. Prevention strategies may include energy conservation strategies, such as pacing of activities. Splints, orthotics, and mobility aids can be used to protect joints from unnecessary stress. Regular movement can prevent stiffness and pain, as well as associated health risks from prolonged positioning, such as blood pooling, pressure sores, and infections. Maintaining a healthy body weight and having a healthy lifestyle can also reduce pain. Every effort should be made to prevent pain that occurs during healthcare diagnostic and treatment procedures, such as needle pokes or rehabilitative therapies. Distraction methods, topical analgesics, and relaxation strategies such as deep breathing may be effective to minimize pain. To summarize, there are many safe, effective, and easy-to-apply strategies to help prevent or relieve pain. Most people benefit from a multimodal approach to pain management that includes pharmaceutical, physical, psychological, and prevention strategies that alter nociceptive activity in the nerves, spinal cord, and brain.